My presentation topic will be on the positive effects of magic mushrooms on depression. From what we have studied in class, there are some unconventional types of treatments that have popped up on mainstream therapies. In our last presidential election, aside from voting in the first black president, we have also introduced the legalization of recreational marijuana. Before this, we already have marijuana use in the medical field, and these states include Massachusetts and California. Now we have states like Washington and Colorado that allow recreational use of marijuana. Marijuana is a prime example of unconventional drug treatment, for many see it as the gateway drug that can lead to other drug addictions such as heroin and cocaine. However, medicinally it has been proven to help with treatments, especially with cancer patients undergoing chemotherapy. Thus we have this controversy where on the one hand, some people associate marijuana as bad, but on the other, some people see its value in cancer therapy. Magic mushrooms may also fall into this controversy. It carries the negative stigma that other illicit drugs have, but it also have beneficial therapeutic effects. Some studies have shown that it may have positive effects on depression. Magic mushrooms are derived from fungi, and eating them can produce a psychedelic effect. While tripping or under the influence of magic mushrooms, users report the effects to be magical. They gain a sense of euphoria and may hallucinate. For example, on magic mushrooms, you could see everything around you in more color and vividness. If you're watching SpongeBob, it may look like this picture on the bottom left of the PowerPoint rather than what the show normally looks like. The active ingredient in magic mushrooms is psilocybin. So why is there a belief that magic mushrooms can help with depression? In an earlier study done by Carhart, Harris, et al., the researchers tried to see the effects of psilocybin on accessing a person's memories and emotions. Depression causes patients to get into a state of gloom and melancholy. They think they are helpless and hopeless, and are stuck in a state of sadness that is hard to get out of. The researchers thought that by using psilocybin, maybe they can access positive memories and emotions to bring patients out of the depressed state. For their study, they had 10 depressed patients. They split the sample size into two groups, a control group with a placebo and a test group with psilocybin. Under the effects of each, they showed positive personal images of the patients and allowed the patients a few seconds to recollect and re-experience these images. This triggers brain activities, and these brain activities are measured by MRI imaging. From their observation, the researchers noted enhanced activity in memory areas in the brain like the limbic regions. In addition, they saw increased activity in the visual and sensory cortexes. This shows that the drug can increase sensation, producing strong memory-related effects. Comparing to the test group that had all these symptoms, the control group with a placebo was normal. Overall, this finding shows that psilocybin may help with enhancing memory activity, which can help with psychotherapy and depression treatment to reverse negative cognitive biases. In another study, the researchers wanted to see the lifetime effects of psychedelic drug use. These researchers want to see if there are any bad long-term effects of magic mushrooms. In addition to testing psilocybin and magic mushrooms, they also tested LSD, mescaline, and peyote, which are other psychedelic drugs. The method they used was a population study consisting of 130,000 people that are randomly selected based off a few special criteria that made the sample consistent and representative of the actual population in the United States. They covered confounding variables such as influences of other drugs, such as marijuana, and they used an odds ratio to determine the results. More will be talked about on this on the next slide. In the end, they found that there were no significant negative associations between psychedelic drug use and mental health. In some cases, they actually found an improvement to mental health issues. So the researchers used an odds ratio. An odds ratio allows a way to link an outcome to its prior exposure. In other words, how the independent variable is associated with the dependent variable. In this case, the independent variable would be psychedelic drug use, and the dependent variable is mental health response. An odds ratio of 1 would mean no effect, and an odds ratio of greater than 1 would mean adverse effect, and an odds ratio of less than 1 would be a lessening of the adverse effect, or good effect. As you can see in this chart, all significant values were less than 1. These are shown in bold. And most of the results that were significant were also less than 1. For psilocybin, which have been specifically circled out, it was significant in helping with inpatient patient treatments. For major depression, it was also effective as a treatment, but the results were not significant. In this third study, the researchers looked at psilocybin and amygdala reactivity to negative stimuli. The amygdala is a part of the limbic system and is associated with some memory and learning. It mainly deals with emotions that are related to fear and aggression when stimulated. Using 25 volunteers, the researchers provided these volunteers with psilocybin, and they also gave them a placebo. So there is a test group and another control group, which is very similar to the methods in the first study. Their study was double-blinded too, so neither the administrator of the drug nor the subject knew if they were taking a placebo or the actual drug. In addition, these researchers also controlled for confounds. In the end, they found that people who had psilocybin had less reactivity to negative stimuli. This shows that they were better able to withstand negative traumatic episodes. In addition, the subject's mood were also positively heightened. Since patients with depression can undergo major depressive episodes, this research indicates that psilocybin can maybe protect patients from that. And the mood boost can also help patients feel happier, bringing them out of the depressive state. From these studies, we can see that psilocybin, the active ingredient in magic mushrooms, may actually help with depression by uplifting the patient's mood. In the future, it may become a therapeutic way to treat patients with depression. I hope you enjoyed the presentation. Thank you for your time.